We are recording, and it is exactly 6 p.m. Eastern. Welcome, welcome. Week 7, everyone. Combination of week 6 and 7. It's going to be a lot of information to cover. Um, everyone should have received their exam grades. There are a couple of folks that are going to chat with me after. And if you're wanting to discuss anything about the exam, you can hang tight after class today. I'll put people in breakout rooms, and you just be patient with me. I'll get to everyone. And so, let's see here. Make sure there's not anyone that's trying to get admitted into the room. All right, you guys. So week 6 and 7, we're going to cover today. We are going to, I'll do go over a summary of everything from 6 and then move into 7. And then there'll be a few questions that I'll ask because this will be interactive. And then we will have a breakout session. Everyone should have completed their case study. And just like the previous one, if you could please submit it to me, like you did before. I just want to have an idea of where you are with the concepts. We'll work on it together towards the end of the class. Well, you guys will work it out in your groups, and then we'll come back just like before and go over a few things. Let's get started. So everyone, I know you guys, exam 2, let me just say that these exams are weighted heavily. It is what it is. In comparison, if you look at all the other points and different things or what have you, Fortis really does put emphasis on those 3 exams. It's not too late. Midterm means you have 50% of your semester already done. So just make sure, if you haven't gotten serious about things, and I know everyone is, that you really, you don't want to end up repeating stuff, but it is what it is. All right, so let's go into week 6. I have my notes here. Community assessment evaluation, that's our chapter 13. Keep in mind that if you do end up moving into the, sorry about that, mute your phones. If you are considering seriously going into public health or population health or what have you, community assessment and evaluation, that's your head to toe of your community. That's pivotal in everything that we do. That's where you get your baseline. You look at what's needed in the community. So some points I want to cover with chapter 13 is that the public health nurse in particular is seen as the ideal person to work with the community and to see the community as a client, because everything we do is not on an individual basis. Our goal is like, what's the best program or what needs to be done so that everyone gets improved health from this, and not just one person. And then when you focus in on the community as a client, you're looking at, there's always going to be primary, secondary, and tertiary prevention interventions that you'll be focusing on. And then pay close attention to your box 13.1, where it just goes into some definitions that I think that are important, like utilitarianism, which means doing the greatest good for the greatest number of people. So whenever you guys you're doing your case studies and you're looking at, even when you're doing your exam, just if you get into that mindset and think the greater good and not just that one person, that might help with things. And then again, your community assessment is literally just taking stock at what is both inside and outside of the community, and identifying and analyzing the conditions. So again, that's your head to toe assessment. So I just want to really emphasize that. Make sure you guys are reviewing all of it. The box 13.3 I really like, where it talks about common elements of assessment and planning. So when you're doing, if you're going to do your community assessment, and I'm not I don't know if you guys, I teach another course with another university, and they actually have to do windshield surveys and all of that. They have to do a community assessment. You want to organize, you want to engage the community because they need to know that you're there. There has to be, it's a process. You develop a plan, you bring in those community leaders, and then you conduct the assessment and evaluate, and you go from there. So just know that chapter 13 delves into the community assessment and evaluation. So that's 13. So when you move into health education and community, when I think of nursing in general, regardless of what you do, we are like kings and queens of health education. We should be teaching, 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 teaching. And you're not just giving someone insulin, you're teaching them about the numbers and what it is, and when, the NPH, the cloudy versus the clear, and when you need to eat and all of that. So you should be educating your patients anyway. But when it comes to health promotion and health education, you want to make sure that you are educating across all of those different, the primary, secondary, tertiary. And then, I know we teach you that primary is, you're doing a lot of education, but if you ever see a test question where there's a disease that's there, you can always educate someone on their cancer, but they have cancer. So that's tertiary. And it's not going to trip you up. Just know that if you're doing primary, it's literally no disease exists at all. And you're providing an immunization, or you're doing a teaching about the benefits of the food guide pyramid or what have you. No disease exists, and then your secondary, there's some kind of screening or surveillance. But anyway, going back to education, health promotion and health education and learning are different. And I highlighted that. And you're not going to come in knowing what's the best type of education right off the bat. And it's going to take some time. Even when you go in and you may have a patient that's a doctor, or you may have a patient that's homeless. You don't want to assume either, because you're going to have someone that's homeless with a PhD. But just know that there are two, in chapter 14, they talk about two important barriers to learning related barriers they emphasize. And one was low literacy, and the other was motivation. So if you're dealing with someone with low literacy, that's going to be challenging for you, because you need to make sure that you properly educate them so that they understand. And motivation, that has to come from within. Like, you have to be motivated to learn what I'm teaching you today. So that has to come from you. So, but those are two barriers. They have to understand that. You have to understand what I'm telling you, and you have to want to learn. So that's what that's all about. And then this is my first question. So health behavior is greatly influenced by the groups that we're with as well. So groups and norms and standards as well. If you're going into community, like when I work with my Native Americans, there's a set of norms that have been there since what have you. So I have to come in and be respectful of all that, and what have you. So let me ask Jessica. So I'm going to ask everyone different questions, not just Miss Jessica. Jessica, so this is straight from your text, so you should know this. You are trying to teach a group of 5-year-olds how to effectively wash their hands before meals or after they have done an activity or touched their hands. You know that what activity can you think of that would help them to learn that particular skill? Don't make it difficult. We do this all the time with our kids, if you have kids or nieces or what have you. What kind of activity? We do this all the time with kids or nieces or what have you.
Like teaching the ABCs, like to wash the hands.
Yes. Somebody else was saying something, but I thank you, Jessica. Sounds like there was some background. Okay, maybe it's just me. Yes, absolutely perfect. Great. So you want to relate to to the age group that you're teaching, and ABCs, different songs that they love that last a sufficient amount of time for them to thoroughly, effectively wash their hands. Very good, thank you. And then moving on, so that was the 6 pretty much there. Again, you always want to just make sure, I would like look at the objectives, even if you skim them, and by the time you're done, go back and look, and like if you can thoroughly answer what the objective is, or you understand it, then that's good. Because you always want to repeat, and go back. You just don't want to read a chapter one time and what have you. You guys know this book reads to you too, so you can, there's different ways to absorb it. So week 7 is a little bit heavier. It's a mosh posh of different stuff that's talked about, like chapter 5. And how they put this together, I'm just a messenger. But anyway, chapter 5 goes into economics of the U.S. healthcare delivery. So just some things I have written down that I just want to emphasize. Our healthcare has changed a lot since the 1800s, and we all know that. And there are certain things you want to know. You want to know the 4 basic components that provide the framework of healthcare services. So there's a need, service need. So there's something that needs to be done. Intensity, so the level of that particular service. The facility, is it hospital, is it nursing home? And I'm sorry, service needs and intensity, that's one thing, I'm sorry. So that's the service needs and intensity, so whatever that act is and what level that is. Facility is where it's going to take place. Technology, what technology is being used to carry that out, and labor workforce, that's us. And then they talked about 4 major factors associated with growth and development in healthcare. That's labor and associated costs. That's the cost to pay for the RNs and all of that. Technology costs for that. Service intensity, if you have someone with high acuity, low acuity, what it costs to actually render that service. And then available facilities, hospitals, and are there some people like on the reservation, we have to fly them out because we don't have that service available. So these are things, again, a lot of this stuff, you have to just memorize it. And then when you go out in the real world, you'll be like, oh, that's why we have to send Billy Joe out to a level 1 or level 2 or what have you. And chronic diseases, they're becoming the number one, the major factor as far as driving healthcare costs. Back in 1800, people, they died from the bubonic plague and the flu and, all that other stuff. Now it's these chronic conditions that account for 45% of American spending is at least on one chronic disease. So hypertension is a chronic disease. Diabetes is a chronic disease. Just let somebody in. You get the point. So that accounts for 45% or 50% or 45. I'm not going to change the numbers. That's a huge chunk. Is on chronic conditions. So as a public health nurse or as a nurse, whatever you decide to do, you can work on those on this primary and secondary level. Somebody has a strong family history of diabetes, it's like, what's diet, exercise, what are you doing? Screen them for diabetes, And so don't let that diabetes happen. You can help with those healthcare costs. And for your family, for people to, anyway. And that in the beginning of the century, healthcare costs was financed by, they paid for it with chickens or eggs, or they paid the doctor coming out to the house. Now it's third party. Third party is the patient is one party, the facility, and then who's going to pay them. That's why they always, when they call, they're like, they want to know how you're going to pay them before you even make the appointment. They just do it respectfully, but they want to know how they're going to get paid. So that's your third party. And that talks about the rise in healthcare costs. The Affordable Care Act was passed, and that was one of the different methods that was used to try to help with these costs. Just get everybody insured. And then one of the things that is, I don't know, that kind of I don't want to say bugs me, but I've been in this business so long, so this really kind of drove into me excessive and ineffective use of goods and services in healthcare delivery has been viewed as the major cause of rising healthcare costs. People that wanted me to refer them for like lipo and tummy tuck. And I'm like, but I can refer you for, one of our nutritional classes. And so that as well. So just being mindful of all of that when you go into the nursing world as well. Because the thing is that the rising healthcare costs, and I'm not going to get on a soapbox because it's in the text, you've heard in the United States, we're like, world leader and all this stuff, but healthcare, we suck. For the amount of money for a superpower, Europe and all these other countries just make us look real bad as far as like our infant mortality, all that kind of stuff. I'm talking leading, I'm not talking like third world countries. I'm not going to mention any. I'm just talking like as being, industrialized. All right. I did get on the soapbox. I'm sorry. And so just keep that in mind. Try to do your best to keep the cost down because again, as RNs, you're going to be seen as leaders, charge nurses, and all of that kind of stuff. Do you need to bring in an agency nurse, or can you get on the floor yourself and work? You could. But anyway, that's why I have a couple of jobs. I'm trying to keep healthcare costs down and pay off some stuff. But anyway. And as an RN, you'll find too that this is a sidebar. You should definitely get yourself what I call like a nice little side hustle. After you get comfortable and what have you, you'll find that, I used to do wound care on the side. I have done little things, non-stressful jobs. You have a job that's your bread and butter, stressful as it is, health insurance, 401k and all that kind of stuff, retirement. And then you have your fun job. One summer I took my daughter to summer camp. I think I told you guys, I didn't pay a dime, like 10 grand. But anyway, okay, keep costs down. All right, you guys, because we have a lot of stuff to cover. So then we know about the uninsured as far as costs, and that goes without saying, the working poor, older adults, children who lost their jobs in an economic downturn in 2008 when the housing crash, boom, went down. So just keep that in mind. There's a lot of folks without insurance or not able to pay co-pays. All right, I want to make this sound sad. So now I'm going to move on. I have a question that I would like Mackenzie, and I can't write your name. You messed up my pen, Mackenzie, from afar. I'm just kidding. Mackenzie and Letitia. So then how can, and I want to answer from both you guys, and plus there's plenty of questions to go around. So for Mackenzie, McKenna, I know your name, Miss Chavez and Miss Battle. Nurses have to be, how can nurses make effective changes in healthcare? How can a nurse leader make effective changes in healthcare? What's the first thing that comes out of your mind? Keep it simple. Just think you're working on the floor, they're a charge nurse. I just gave you one example, but.
Planning ahead.
You definitely want to plan ahead for staffing. I'll give that to you. Plan ahead with your staffing. Look at your staffing. Always keep track with your staffing ratio and acuity. Okay, I'll take that. I'll take that. Okay. All right, McKenna.
Yeah, could you repeat the question one more time?
No.
Can't remember it.
As a nurse leader, how can you effectively make changes in healthcare?
Like reporting any issues that the nursing staff has.
Well, yeah, but we're thinking economics, so think money.
Money.
I don't know, just making sure to do proper trainings and.
No, all of those. No, all of those are good. All of those are good. Does anyone else have an answer? I'll take that. I'll take that. Anyone else have anything?
How about not doing unnecessary procedures?
Or being responsible with your ordering and supplies and stuff to keep supplies on hand, but not excessive.
This all day. This all day. And you'll see, I guess, once you get out there and you'll see, don't be wasteful. I'm not saying use the same syringe on the same person, but you know, we're just a wasteful group of people. And I don't want to say in this country. I love this country, but we are wasteful. I had a group of students earlier this week, and I'm like, bring your lunch. I do population health clinicals with another university. I'm like, bring your lunch, because you can't leave. They DoorDash. I let them DoorDash. I mean, it's not my money, but I'm like, why you can just pick up a sandwich? We only here for like 6 hours, 7 hours. Make a PB&J. Who doesn't like PB&J? Make a, I'm gonna rest. So I always have tuna in the car. I know it
I
sounds
don't
gross,
like
but
peanut
like
butter.
tuna, those dollar tuna packets. See, y'all didn't grow up. See, they DoorDash Chick-fil-A. I was so embarrassed. The front desk guy was like, it was a big old bag. I'm like, we only okay, enjoy your waffle fries. Y'all just gonna be some unresourceful nurses. But that's what you want to do. If you have an agency, so I work agency. So if you have an agency nurse and you're let's just say you're stopping, I'm scheduled to work, and you notice that your census went down, call me off. I'm expensive. I am, as an agency RN. Send me home and let your staff stay or whatever. Anyway, again, we got to move on with our life, but just keep that in mind. Chapter 11. So now we're getting into infectious disease prevention and control. So the burden of infectious disease is high for both how it affects us as human beings and from an economic standpoint. And then keep in mind that prevention, especially when it comes with infectious disease. I mean, I just need to mention COVID, and I'm not even gonna go there, but think prevention. I have friends of mine that got COVID 3 times, and I have friends that have never gotten it.
I had it 3 times.
I mean, so that alone just breaks my heart. I mean, they're living, breathing. Letitia's just living, breathing. But I'm like, how can you? We're not gonna go there. We're not gonna go there. But no, that's what we're thinking. You're gonna look at how it's transmitted, how is that infectious agent transmitted, how is it received, how is it prevented, and how can you control it? So keep that in mind. And then it always talks about that pyramid, the host, the environment, the agent, and the chain, breaking the chain. So if you can somehow break the chain of either one of those, then your disease will not occur. And I hope that makes sense. I don't know. You need a host, you need the agent, you need the environment to be just right. So if one or many of those things don't occur, you won't have a disease. Infection agent. A community level must be aimed at breaking the chain, linking the agent, host, and environment. So if you can somehow attack it from one or all of those levels, then that's what you go to. And it just mentioned, it was this reason that during the rapid and extensive spread of COVID-19, remember, it never existed before, ever. Mask wearing and social distances were instituted because we were trying to figure out how to break this chain. I guess they're still figuring it out. I don't know. So, so you have to always constantly be vigilant. Again, I've been in the business for a minute. I've seen some things, and I have kept myself safe for the most part, and my family. So remember, you're bringing home stuff to people. So hope you take your shoes off, going through the garage. I have a process. I don't want to get into all that, but if you guys do your L&D rotations, those nurses change in the locker room, and then they change out. They leave their shoes and they leave their work shoes there. Everybody has a different little thing. Don't get caught up on them. Remember, you're bringing stuff home. No pressure. Infectious diseases are preventable. That's what your book says. So preventing infection through primary prevention is where you want to live. I'm not picking my nose. It's right here underneath my nose. this is scratchy. That's where you're gonna get the most bang for your buck. Primary, primary, primary. And so as a public health nurse, community health nurse, you're not doing this by yourself. You're gonna be working with a plethora of people. When we had the syphilis outbreak, CDC came down, we had the state, we had the county, all of that. It gets people attention. Again, think COVID. Everybody was on the TV, radio, and all that kind of stuff. So health promotion and education, you want to, again, as far as infectious disease, changing behaviors. Okay. I got an instant message from somebody. Never mind. Keep it rolling. Keep it rolling. So here we go. So nurses play a key role in all aspects of prevention and control. You have to cooperate with everyone involved, especially when you have an outbreak. So now I'm going to share my slide, and Jessica, McKenna, and Letitia will not be answering the following questions. I have 4 questions. I have Miss Ashlyn, Jonathan, Elizabeth, Lizzie, Ashley, Angel, Miss Elizabeth, Olakunle, Sharice, and Jasmine. I have 4 different questions. Got a little slide. All right, so let me hear from Jonathan and Jasmine for the first one. Read it and just give me your answer. You can talk out loud. Give yourself a second to read it, and then whoever wants to go first.
I'm gonna say, a first step, building trust.
It's one answer. That might help you.
I would probably say 3.
Say 4. I'm stuck between 3 or 4.
Jonathan, your final answer is 3.
Yeah, I said 3.
Okay, Miss Jasmine.
I said 3 or 4. I'm trying to look, and I guess 3 makes more sense. You're getting more people involved. You can work together to come up with the plan on what might be the best form of action.
I like that. Jonathan?
Yeah, I chose number 3. It's kind of the same rationale. What was that?
Why? I want to hear why. I
It-
want to hear your response.
Yeah, so people within the community, I think, can really help come up with best practices for reaching out to non English speaking immigrants. I think they know a lot about the community and best ways that they can impact their community.
Very good. The answer is 3. Okay, so who else have I? Do I have Angel and Miss Lyons? Number 2.
I think I would probably go with number 4, explain the severity of the consequences of lack of immunizations, just because it can have such a huge detrimental effect on a community if people aren't up to date on immunizations.
I would do 1.
Your answer is 1,
Yeah,
and that was from Angel.
yeah.
Neither, you're correct. Anyone else?
3 then?
3,
Why 3?
because you're using the trusted community leaders. They probably already, the
They already
undocumented
have
residents
respect for
probably,
them, and
yeah, already trust them.
yeah, that makes sense, Ashley.
But well, let me. I'm gonna mess with y'all for a second because I love this. I
You
love this
just have
kind
to
of
play
stuff.
the devil's advocate, don't you, Professor?
But in a good, I want you to get it, because think about it. If everybody understood why I want them to have the flu shot every year or the COVID vaccine, I'm not going to get into any politics or anything like that. So I just kind of have to make it make sense to me. I know we're doing it with undocumented. They throw stuff at you. This is HESI stuff. Throw stuff at you because there are folks that don't vaccinate their kids, and that's their business. So it's not even to me. It's like, no, because I can generalize that with anybody trusted. Because when you work, if you go on any place you go, especially if you look different from that person and you're coming out like, you need to get your shot. Who are you? I don't know you. And you're in my community. You don't speak my language. You don't look like me. So very good, ladies. There's nothing wrong with either one of them, but it's always the best answer. Always the best answer. And that's what gets you tripped up on exams. They're all great. You can do all of those. You can literally do all of those and they're not wrong. What is that? If you had to choose one, and that's how they're. So for the next one, may I have Miss Olakunle? And do I have Charisse on the line? Is Charisse with us today? Not Charisse.
I'm here.
Okay. You want to talk on you guys talk on the next one, please.
I'm trying to read the question. I'm using my phone for this.
You're fine. You're fine. Charisse, take your time. I'll give you guys, 30 seconds. It's fine. Read it. It's good. It's more than one answer.
So we select all.
You could.
Is it 1, 2, and 3?
You always want that trusted community leader. You can definitely post flyers. Radio announcements are good too.
Yeah, 2 is good. 3 is wait. 3 said. I get like wait. Yeah, 3 is good too.
So the answer is 1, 3, and 4. But
1,
if
2.
you had said all for my exam, I think that would have been great. But you definitely want your trusted person. People tend to like flyers. Not everybody has, most people have radios. I don't know when the last time somebody picked up a newspaper. Does anyone picked up a newspaper lately?
No.
But you could, but my thing is definitely, if I had to rank them, I would do 4. I would do flyers because, hand them out. I would have someone of that ethnicity and spoke that language to hand it out, or go with the trusted person in the community. Let's say if I was the person, I would get the trusted person with me and translate. Whenever I have someone that speaks a different language, let's say if I have a Spanish speaking person and they're like, no, I'm good. I want English is good. I'm like, okay, but let me bring in a translator because I want them to translate it how y'all really talk it in your language. I don't want the that was this is ours. I wanted to talk to you because I want to make sure you understand what I'm trying to tell you. All right. So the other people that did not answer, I don't know who. Who is left? Is it
Haven't answered.
okay? And then besides Ashlyn, because I'm trying to look at who's here.
I answered on one question, but like not of my own question.
Okay. All right. So I need 2 people, but I need Ashlyn and Ashley if you want to answer. But did everyone answer a question? I think we're short a few people today, and I'm trying to look at my list and see who's here. But anyway, I'm taking it away from you. I'll let you read it. Don't let it trip you up. You should be able to exclude one or two of them.
Is it multiple choice or just one answer?
Think Hesse is the best answer. So imagine if you, I like to put myself in people's shoes. If I was an immigrant and an English speaking community, what would I want?
Would it be 2?
And then Miss Ashley, were you going to answer this one too, as well?
Yeah, I said 2.
Oh, you said 2. I'm sorry.
Yeah.
I'm sorry.
No, don't be sorry, girl. Don't be sorry.
I'm stuck between 2 and 3.
Why are you stuck on 2 and 3? Let's talk it out. Why do you like 2 and why do you like 3?
Well, all the other questions have been about involving community leaders. So that's why I'm kind of leaning with that one. And then I like 3 because it's already like a developed brochure, just translating it to a language that they can read it in.
If you had to choose one, this is Hesse stuff.
I
This
guess
is
2
Miss
then, because that's kind
I
of
don't
like the other ones.
I
Yeah,
want you to be happy.
I'll just say 2. Yeah.
Say with bass in your voice. 2. Final answer. The answer's 2. Let me go over it. So most questions are, if you go there, don't go there. There's an art to taking tests. You want to, when you read a question, you just got to know how to pick it out, pick through it. Does that make sense? And so what is appropriate for someone? Now, again, it's not telling you their literacy or anything like that. So I am not going to use the state health department, something I might use at the university, but I'm not going to use for my immigrants. And then if you using the services of the local university communication department, that's just was thrown in there just to, if you said 1, I think I would have broke down in some big old tears. And then, so you're looking at 2 and you're looking at 3. So if you look at 3, to me, like that's a lazy way out. That's just me. You're gonna hire a professional. Then we just talk about healthcare costs. You're gonna hire a professional, pay them $1 billion to translate something. And who knows, everyone knows that Spanish is different in different countries, different dialects of different stuff. So how do I even know he's going to translate it appropriately for the immigrants from this particular village in this remote area and da 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 da. So yeah, you always want to involve, if you're going to do a community assessment, you want to find out who are the ballers, who are the people that I need to meet and talk and get to know, because they're going to give you street cred, they're going to introduce you to the community. You can have the most lovely theory, evidence-based peacock question, beautifully developed, nice golden whistles on it, and they will tear that paper up and use it for cat litter. I'll say cat litter. So you want to have someone, and I learned that the hard way. But all right, so very, very good, everyone. Again, this is a way to test our critical thinking, and that's what we want to do. All right, you guys, believe it or not, we've got a couple of more chapters to get through. Let me stop sharing my screen. And then if you feel like you need, I like to just go through, but if you feel like you need to take a 5-minute, go to the bathroom, just come back, please. So very good, very good. Now, again, chapter 12 is just I see it as a continuation of chapter 11. This is where they talk about the STDs, the HIVs, the hepatitis, and what have you. So key points that I want to make sure that we talk about. When they mention about sexually transmitted diseases, it says most communicable diseases are preventable, most, because they are transmitted through behavior. So when you are going out into when you are going out, excuse me, guys, I'm always got to check to see what's going on with my kids. If you're going out into the community and you're dealing with a specific disease and it's behavior related, sexually transmitted, could be, again, behaviors, not doing this, not doing that, safe practices and what have you, then that's what you want to target your prevention on. Know how to target the enemy, if that makes sense. So then again, it goes into different STIs. That's another stickler. It's STIs, not Ds. What's these? It's sexually transmitted infections, not diseases. It's like old school. But anyway, it's a pet peeve of mine because you educate on prevention. We would go out to the high schools and do primary and secondary. We would do our PowerPoints on STIs and how to prevent them. And then we would come back with permission and do screenings for urine and blood if they opted for it. Many STDs are asymptomatic, and asymptomatic means, I'm not going to pick on anybody, we should know that means without symptoms. So know that. You'll be hearing that word. You might be hearing that word. So just make sure you have a good overview of the STIs. You don't have to necessarily memorize them, but just, again, when you look at those objectives, make sure that you understand, because they go over so many of them. But sexually transmitted is sexually transmitted, not a washcloth, it's not a toothbrush. Keep that in mind. The one, hepatitis A has a vaccine. I am a vaccine diva. Anything that you can get vaccinated for, that's my thing. Most people don't realize, they hear B and C, but hepatitis A does have, there's a vaccine for it. So, and the use of the vaccine in children has led to a reduction in hepatitis A and a lot of things, not just hepatitis A. And early detection. So that's huge if you work, especially in the health department, if you're in the STI division or what have you, they talk about early detection, early detection, early detection. So that's where you'll be able to get in, detect it, find it, get them treatment, and prevent spreads, and epidemics and outbreaks and all of that sort of stuff. And then part of all of this is partner notification, making sure that they get the screened. You can offer, you cannot force anyone. And then that is, as a public health nurse, you have to be gentle and tactful when you talk to folks and their partners and what have you. I always try to recommend bringing a partner in so that we can, sometimes folks don't want to talk to their partner, and I'm happy to with that person there. That's a HIPAA. And so sometimes it goes well, I don't know. Anyway, so as a nurse, you are the counselor, you are the educator, you're the advocate, you're the case manager, you're the primary care provider, and you are the cheerleader. I added cheerleader in. And so when you deal with folks with, especially with STIs, and certain ones have a stigma attached to it, I'm not going to get into all of that. You want to make sure that you're non-judgmental. That goes without saying. You have to develop that poker face. In the back of your mind, like, but you have to, or they won't come back, and that sort of thing. Primary, secondary, and tertiary prevention are discussed. We live in primary, that's where we want to be. And then we are in the position to help to make sure that communicable diseases, infectious diseases are handled effectively and prevent from spreading to others. And then you have public health issues. And so then going into the chapter talks about primary prevention, for, and then secondary prevention, and then tertiary prevention when it comes to these STIs. I'll say STDs because it's what it says, but it just bugs me to say that. Sorry. But anyway, when you're thinking primary, and I'll just kind of go over some things. I won't pick on anybody. Primary education. So they gave an example of providing a community education. That's like, if that was on a test, that would be like, oh, okay, educate. Okay. And then they've mentioned vaccines, anything with education, anything with vaccines. And then your secondary, an example that they mentioned, and I really like that they give example, is that you notify partners and you trace contacts. Like, I love doing that. I know that sounds like boring, but it's like, if I can get people to give me names of folks, and then from there, and then folks give me names, folks, it's wonderful. Because everybody should get screened at least once a year per CDC. We'll get into all of that. To prevent stuff. That's my favorite word. So then testing, screening, even when you do that TB skin test, that's considered secondary. So if you were to see that, just know that they're looking. Secondary, you can be looking for something, or you can be trying to notify and trace contacts. And then tertiary, they mentioned in the book about support groups for people with certain conditions like herpes or HIV. So they have something. And then you're working with managing complications and having the best life possible. You guys are doing good. It was a lot. 6 and 7. We're going through 6 and 7. Then we're going to do breakouts. So stay with me. Our breakout is going to be on our chapter 27. It's a case study that I used to use in one of my other classes, intimate partner violence. I hope you guys had a chance to at least work on it, look at it. There was a disclaimer that I placed there as well. So just keep that in mind. So some highlights, I just want to make sure that you guys understand that it is violence and human abuse is considered a public health concern. And you may see some things inside the hospital and outside the hospital. You ever wonder why, if you go to a labor and delivery unit, well, for our hospital, there's always a security guard there. I never figured that out until I'm like, oh. And the emergency room, there's always a security guard there. So anyway, violence and human abuse is a public health concern. I mentioned that. So then you want to, part of your community assessment is also looking for violence and that sort of thing. And abuse in family members can happen to a spouse, an elder, a child, anyone in that unit, even mentally challenged. Abuse can be physical, emotional, or sexual. And then spouse abuse is usually wife abuse, physical, emotional, frequently, and coercion. So then as a nurse, you want to identify the potential victim. You want to assist them in getting care and help if they so desire. There are different treatment facilities that are available for the family unit if need be. All right, you guys. And then they mentioned that COVID increased the incidence of family violence. I don't think we need to really go into that. People were home that usually weren't home certain times of the day, and folks have to realize that, oh, I don't know if I really like them or her or them. And so people were home from school and folks were spending more time together that usually did not spend time together. All right, so I am going to give you guys this 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, there's 12. And so you'll have 3 in your group. I just randomly I'm going to put you guys in your breakout groups. Just make sure that you have you should all have, and there are
Professor, can you repeat that? You cut out and I didn't hear what you said. I'm sorry.
No, it's okay.
Same, it
We're
froze.
gonna,
Oh,
we're
thank
gonna,
you.
okay, can you guys hear me now? Yes, okay, all right. So I'm gonna put you guys in your breakouts, get out your case study, intimate partner violence, work through it. I was just looking to see how many questions. I believe there's 12 or 13. Work through your questions. I'll give you guys a good 30, 40 minutes. We'll come back and then we'll just round robin and answer the questions. And we should be out close to time. Anytime we have an exam, we don't have class afterwards. I think you guys know that. So the next week is like a lot of stuff. I don't want to keep you guys any longer than I have to, but I got to make sure that I cover some things. But we don't have class because you have the entire class to take the exam. Same thing for exam 3. And then I don't want to get into it. HESI review as well will be during class, but we'll worry about HESI review later. All right, let me get you guys into my little mouse wants to misbehave. Into your
Fortis says
breakout.
on 3.
Questions before I get everyone into their groups? Make sure you have your papers, your case study out. Everybody works together. However you guys want to split it up is fine, but I'll be coming in to check on you, people to talk to each other. Communication. All right, let me do these rooms. Okay, it automatically put you guys in the rooms and off you go. Hi, Therese, what group were you in?
I was with Ashley Keg and Elizabeth. Oh,
Let me get you back here.
thank you.
1, 2, 3, go. Welcome back, Miss May. I just realized we are running, time flies when you're having fun. We are running short on time. So I'll wait for everyone to come back in. Time flies when you're having fun. I realize we have like 11 minutes left to do this. We are going to, you guys just email me your answers, but in the meantime, I do want, we'll go over 4. So room 1 with Angel, take number 1. Room 2, Ashley's group, we'll tackle number 2. Room 3, Jasmine's group, please tackle number 3. And room 4. So then we're not gonna read the scenario. Everyone has it in front of you. I'm just gonna ask, and it doesn't, Angel or Lizzie or McKenna, what behaviors might Angela display that could indicate she is experiencing intimate partner drama?
So we put bruises don't match the injury that she's stating she has. She's nervous when asked a question, quiet, makes excuses. Her partner doesn't let her speak.
Excellent, excellent. All of those are correct and more. Anxious, unwilling to make eye contact, making many excuses, everything you guys, you nailed it. Moving on to question 2, considering the determinants of health, so it gets a little bit more challenging for this family, biology, individual behavior, health services, social service policies. What are the risk factors for experiencing intimate partner violence? Ashley, Sharice, and Elizabeth Olakuma.
I did moved in after 3 months. She got pregnant right away. You do kind of need to know more about their backgrounds because one of them, he could have grown up seeing this. So, this might be what he's used to, or doesn't realize, that it is wrong. And then he showed early signs of aggression, easily angered, apologized and did it again. He's jealous, doesn't want her to let people know what's happening.
You guys nailed it. Let's skip question 3. Let's just skip it. So group 3, answer number 4. Please.
Okay, so what we said, is to ask her if she's safe, upon arrival.
Yep.
Educate her on the importance of safety of the baby. Just offer her information about, sorry, my son is crying, about support groups, for domestic abuse. And I added to educate her on the signs and symptoms of labor in case she started labor early.
All of those are perfect. I like the fact that you asked if she has a safety plan. That was listen without judgment. And then definitely the signs of labor are awesome. But definitely they mentioned safety plan and listen without judgment were pivotal. All of this, when you guys, if you go any type of nursing, you need to listen without judgment. And that's just, it takes time. You literally have to develop a face. This is my face. All right, and then let's wrap it up with question number 4. I mean, sorry, Scott. No, don't do 5. I don't know how far you guys got, because some of this is really like, I don't know. Did you guys answer 5? Did
For
anyone
our
get
group,
to-
we split it into
Yes.
3, so first 4, yeah.
Okay, if you want to tackle
Answered
5
everything.
or 6, I'll take it.
For number 5, I put A.
The correct
Based off of
answer
Minnesota.
is A.
Based off of
It is.
Minnesota.
So the answer is A. The PHN is not mandated to report suspected abuse unless they suspect there was a weapon involved. I don't know Minnesota's laws. I know the laws in my know your laws. And I'm telling you, as long as you have a phone, you can Google anything. And you guys, with that, there are some people that want to talk to me. There's some people I need to talk to you. You know who you are. It's all good. I am going to hang back. We have 7 minutes to spare. I was just like, oh, but please turn it in. And I do review them. I do. It's not graded. And if you don't, I don't chase you down, but I have a memory of an elephant. So without further ado, you guys have an amazing weekend. There was a question, exam 3 is week 9. It's on your syllabi, but it's week 9. And it's, don't even worry about that right now. Just one step at a time. But again, have an amazing weekend. I'm gonna hang back to if anyone wants to have a conversation. Some people have emailed and talked to me. You're free to go. Have a good
All
weekend.
right, thank you.
Thank
too.
you.
Good night.
Bye.
We can do a group.
Angel, did you need to talk to me?
Angel
Okay.
can hang on. I just wanted
Let
to
me
go over
stop
the.
the video. Oh, yeah. Let me stop recording because the people don't need to